In this brief video, we are going to revisit the statin group. And this is because the statins provide a great opportunity to become familiar with some key pharmacologic concepts, but also there are a lot of really important pharmacological considerations that can impact patient care as it relates to this group of agents. So on the next slide, we are going to get into efficacy and potency. So there are currently 7 different statins, which are listed in this table here, and you will generally hear them compared in 2 different ways. The first is with regard to intensity. So there are high, moderate, and low intensity statins, which is really just referring to their efficacy. So how good is that particular statin at that particular dose at lowering LDL levels? And this will be important because different labs and indications require a specific intensity statin or efficacy. You may also hear them compared with regard to potency, or more commonly, you may hear the phrase equipotent statin dose. And this becomes important with drug interactions and adverse drug reactions, and with individuals that need to switch from one statin to another. So when you hear the phrase equipotent dosing, all this is referring to is which statin at which dose elicits the same lipid-lowering effect. For instance, if your patient needs to switch from atorvastatin 80 milligrams to another statin due to a drug interaction, the only other statin that offers this same lipid-lowering efficacy would be rosuvastatin at either 40 or 20 milligrams. But say your patient was on atorvastatin 10 milligrams, and they needed to switch to another low-intensity statin. Then you have a choice across the board depending on the reason the patient needs to switch agents. So remember that intensity is really efficacy, and equipotency is really just dosing that elicits the same efficacy or intensity. And this topic will come up again with pharmacodynamics in Block 4. So moving to the next slide, statins also provide a great example for adverse drug reactions. One of the most well-known ADRs of statins is myopathy or rhabdomyolysis, and the risk of this ADR increases as dose increases. And this risk can be further increased via a number of drug interactions. So we're going to use Lipitor or atorvastatin as the example. So atorvastatin is one of the statins that are metabolized by enzymes in the liver known as CYP-P450 enzymes. And I specifically want to introduce you to CYP3A4. CYP3A4 is an incredibly important enzyme in the body, and it's responsible for the metabolism of a number of drugs and is highly expressed in the intestinal wall as well as in the liver. So in the case of atorvastatin, CYP3A4 is responsible for its metabolism and eventual removal of atorvastatin from the body. So in the intestinal lumen, CYP3A4 influences how much atorvastatin after oral administration makes it into the bloodstream following absorption. And in the liver, CYP3A4 influences how much and how long the atorvastatin sticks around in the body. However, if atorvastatin is administered with other drugs that inhibit CYP3A4, like azole antifungals, like ketoconazole, macrolide antibiotics like erythromycin, or with things like grapefruit juice, this inhibition of CYP3A4 enzymes in both the gut and the liver allows for more atorvastatin to make it into the bloodstream following oral administration and absorption without being metabolized, and more atorvastatin that is going to be around longer because the liver enzymes are unable to metabolize it to promote its elimination. This leads to an increased risk of myopathy and rhabdomyolysis for the patient. And if possible, based on their lipid goals, may warrant a switch from atorvastatin or one of the other statins that is metabolized by CYP3A4, like simvastatin and lovastatin, to one of the other statin agents at an equipotent dose that is not metabolized by the CYP enzymes or is just metabolized by a different CYP. So the statin class of medications really highlights how understanding pharmacology can aid in making clinical decisions to improve patient care and improve compliance.